Okay, we're talking about all the drugs coming up from Mexico. The best way to get heroin in the United States is to go through Mexico, as odd as that may seem. Why in the world do we take opiates? Well, medically, the reason that we take opiates is because we use it to deaden pain. Whatever it is, hydrocodone, oxycontin, morphine, whatever we're taking, Demerol, Darvon. We use it to deaden the pain, we use it to control our coughing, and we use it to stop diarrhea. It is very good at arresting your intestinal tract. It'll slow it down. And if you've got diarrhea and you take an opiate, then a lot of times it will lock you up pretty tight. Non-medically, opioids are used to drown out our emotional pain, and it does. It takes away the pain. It makes us forget what's going on. It does give us a bit of a rush. There is a degree of euphoria that takes place. It does induce euphoria, and it prevents withdrawal symptoms. And of course, once you start using this stuff, what you are looking for is for the withdrawals to go away. You don't want the pain. You want the pain to go away. Well, the pain is being caused by the drug that you're using to take the pain away. Those are the withdrawal symptoms. Are the withdrawal symptoms the worst? No, they're not. Alcohol is worse. You can get off of opiates or opioids much easier than you can alcohol. However, there is a stronger desire to use opiates and opioids, and that's one of the reasons why people will go back to using, or they'll relapse. Pain is transmitted to the central nervous system through the neurotransmitter substance P. P does not stand for pain, it stands for peptide. It's a peptide structure. The more substance P that is released in the synaptic cleft, the greater the pain that you will feel. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, and the endogenous painkillers are, of course, endorphins, dynorphins, and enkephalins. So we have a natural painkiller in our body, and the opiates will they will take over these slots, and the pain will go away, whatever pain you may happen to have. It's really kind of interesting because different genetic structures, different humans with different genetic structures will have more sensitivity or less sensitivity to pain. Females, for example, tend to be less sensitive to pain than males are. Why would that be? Why would females be less sensitive to pain? What is it about females that they need to be less sensitive to pain? When they pluck their eyebrows, it hurts. So you need to be less sensitive to pain? Is that it? What is it that women, what pain do women go through that men don't go through?
Would it be the toughest pain women go through would be childbirth?
Childbirth, yeah. Exactly. Not only that, but you've got a menstrual cycle every month. And it's not the most comfortable thing in the world. What do men go through every month? Nothing. Trying to put up with the women when they're going through their menstrual period. No, I'm just kidding. That was cruel. Anyway, so women are less sensitive to pain than men are. However, there is a group of individuals that are more sensitive to pain than other individuals. And so if we wander around the world and we look at all the different individuals that we run into, who is the most sensitive to pain? As it turns out, it's redheads. Who do and why? We're not exactly sure, but their genetic structure makes them more sensitive to pain. So if they are in pain and they take a painkiller, the painkiller doesn't work as well on them as it does on other individuals. People with brown hair, people with black hair, people with even blonde hair. The paler your skin, the less sensitive you are to pain, or the more sensitive you are to pain. The endogenous painkillers occupy the substance P receptors, opioid receptors, referred to, and there's 4 of them, and they have they're indicated by a Greek letter. There are mu receptors, kappa receptors, delta receptors, and sigma receptors. Sigma receptors are also receptors for non-opioids. The other 3 are only receptors for opioids, mu, kappa, and delta. Exogenous opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers, and they take the pain away. So the opioids and opiates will actually inhabit those receptor sites, acting as if they were endorphins, enkephalins, or dynorphins. Endogenous painkillers are also activated when an individual feels anxious. It decreases anxiety, and that's one of the reasons why it pumps it into your system so that you can control your anxiety. It produces a sense of detachment so that the pain won't be as debilitating as it potentially would have been otherwise. If you've ever been around somebody that was injured or somebody that was wounded, it's almost like they're outside themselves. It's really kind of interesting. If you work in the emergency room and you get somebody that has just been in an automobile accident and they've got this horrible gash on their face or this horrible gash on their arm or whatever, and looks extremely painful, the individual will act like that arm isn't part of their body. It gives you this strange sense of detachment, like that's happening to somebody else. We had an individual that came in one time, and he was working with a press, and it was this like 3-ton press. And for some reason, he got his hand stuck in the press. You know what that means. Anyway, it cut his arm, it cut his hand off. Cut it off clean. It was really kind of interesting. It cut it off so clean that they thought they were going to be able to reattach it. Actually, they did reattach it. It didn't work very well. However, talking to this guy, you would have thought that nothing had happened to him. Like something was going on with everybody else in the room, but nothing was going on as far as he was concerned. He was completely detached, literally and figuratively, from his hand. Despite the fact that he could see his hand, it was in a pan of ice over on the counter. It was just sitting right over there, and he kept looking at it and acting like it wasn't his hand. As odd, and he was joking with us. I thought that was kind of cool. Anyway, so it gives you a sense of detachment. It makes the individual feel drowsy. In this case, this guy wasn't that drowsy, but he was certainly detached from the predicament that he was in. It deadens the unwanted emotions, and of course, he didn't react in an emotional way. He was actually joking with us, which was kind of cool. I mean, a lot of times you get individuals and they seem to be overreacting to everything. These effects occur because of the inhibiting effect of the endogenous or the exogenous painkillers effects on the locus coeruleus. So it's a locus coeruleus that is controlling all of this information. It's a locus coeruleus that's sending information to different parts of your brain. Actually, it sends it to the thalamus, and the thalamus sends it to different parts of your brain. So it has to do with your locus coeruleus. Opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers. It inhibits the action of GABA. It triggers glutamate receptors, enhancing dopamine neurons in the reward reinforcement pathway. It increases the release and enhances the effect of dopamine, making you feel better. Heroin has the strongest effect of all the opioids. So that's one of the reasons why people take so much heroin. The reward reinforcement pathway performs 2 functions. It signals pleasure so that an act is more likely to be repeated, of course. It signals the alleviation of pain. So it tells your body that you're no longer in pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. Wait a minute. So taking pain away is stronger than having a good time. Really? So now 50 Shades of Grey makes a whole lot more sense. Why in the world would this lady like to be tortured? That doesn't make any sense. Why does this guy like to be... I've never read the book, so I'm not exactly sure what's going on. But he's got a torture chamber, right? Isn't that the way it works in 50 Shades of Grey or 50 Shades Darker or whatever that book is? Anyway, so taking pain away is a stronger reinforcer than giving somebody pleasure. With psychoactive drugs, especially opiates, opioids, the desire to prevent withdrawal symptoms is a stronger incentive for the continued use than the desire for pleasure. So if you talk to somebody who is a heroin addict, they will tell you that shooting up with heroin is like dying. Well, that doesn't sound good at all. But they will also tell you that if they can't get their fix, that they feel worse than they would the pleasure that they get. So what they don't want is the withdrawal symptoms. And with alcoholics, it becomes exactly the same way. Alcohol is supposed to be a fun thing to do. That's why people do it, for the pleasure of it. But the reality is, if you have been drinking for an extended length of time, you have to get really drunk before you feel good anymore. So why do you continue to drink? Why don't you just stop? Well, you can't stop because of withdrawal symptoms. So the pain, staying away from the pain is far more important than the pleasure that you're getting from drinking. So that's why people drink every day. They don't want to go through the withdrawal symptoms. When an individual is prescribed opiates, opioids, and non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opiates, opioids will use the drug in excess to prevent the withdrawal symptoms they are seeking to return to their normal state. So if you are a heroin addict, you will use enough heroin so that you feel normal. Wow. Well, if you had never started using that stuff, then you would feel normal all the time. But now that you do use this stuff, now you have to stay away from the pain. And it's staying away from the pain that makes you go out and get more and more and more of this stuff. So it ain't fun anymore, okay? If you're an addict, being an addict is not fun. You're not doing it for a good time. You're doing it to stay away from the pain. That sounds dumb as dirt, doesn't it? Isn't that the dumbest thing you've ever heard? I'm going to use this stuff until it hurts me, and then I'm going to continue to use it to stay away from the pain. That's the most ignorant thing I've ever heard. But it happens everywhere, with every addict. So does that make them really stupid? No, they got caught. They got caught. Now they can't get out. It's this vicious cycle. Staying away from the pain is this vicious cycle. And now it's not fun anymore. It's not cool anymore. They do it to stay away from the pain. Opioid and opioid-like receptor sites have different functions. Mu and sigma receptors trigger the reward reinforcement pathway. It blocks pain transmission. It changes your mood. It causes your pupils to contract. It depresses the autonomic nervous system. And of course, if it depresses the autonomic nervous system, all of a sudden your breathing slows down. So does your blood pressure. So when somebody dies of an overdose, a heroin overdose, why do they die? They die because they stop breathing. They die because their blood pressure tanks and goes down to nothing. And we get a hold of them in the emergency room, and we have to put them on a ventilator to breathe for them. We have to either do heart compressions to keep their blood pressure up, or put them on some kind of an artificial compression machine. As odd as that sounds, we have to force their heart to beat. We have to force their lungs to breathe, and that's the only way we can keep them alive. If we can do that, then potentially we can keep them alive. We can give them naloxone. Naloxone blocks this whole opiate thing. It blocks it in the brain stem, and of course, then they can breathe and they can their heart will beat on its own. The kappa receptors induce dysphoria. So the kappa receptors have to do with feeling bad. The kappa receptors induce endocrine changes, and they also control pain at the spinal cord level. So they're the ones that take the pain away. At the same time, it gives you pain. It makes you feel better. Dysphoria, that's what dysphoria means. It induces dysphoria. So it makes you feel bad. Now remember, when you talk to somebody that's a heroin addict, they say shooting up with heroin is like dying. That's the dysphoria. It's not a euphoric feeling. It's not a positive feeling. It's a negative feeling. So why do they do it? They do it to take the pain away. I know. Like, this sounds just stupid. It sounds ignorant. But they do it anyway. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. This is weird. Okay, so you've got a rock star, he's for a good time, he shoots up with heroin. Now why in the world would a rock star shoot up with heroin? It makes you feel bad. It induces dysphoria. Now why in the world would you do this? Because playing music gives them this strange high, and they need to come down off of that high. So they shoot up with heroin. It makes them feel like they're dying. So now they feel normal. Because playing music makes them feel euphoric. Okay. So we've got Jimi Hendrix. Jimi Hendrix shoots up with heroin. Actually, his girlfriend shot him up with heroin. I'm about to kill Jimi Hendrix. Are you ready? So Jimi Hendrix shoots up with heroin. He's trying to come down. He has just given a concert, and he was ripping the place apart. He had a great session. So he shoots up with heroin. He rolls over on his back, and he starts gagging, but he can't cough. If we've got phlegm in our throats, what do? We cough and get rid of it. But if you're on opiates, if you're on heroin, you can't cough. It drives you crazy. These people come in and they'll have all this gunk in their throats, and you can't get them to clear it. It just irritates you to no end. They can't cough. You get a tobacco smoker, somebody that smokes tobacco, he wakes up in the morning and he's going to cough for 5 minutes straight. The nastiest, stinkiest stuff you've ever smelled. Tars and gut coming out, and mucus coming out of their lungs. It's horrible. So, but you get a heroin addict, and this guy can't cough. So he can barely breathe, but of course his respiration is shallow anyway. And you can't get him to clear his throat. So you got to go in and pull out. You got to put a tube down his throat in order to keep him alive. This is stupid. It makes you want to punch somebody. It's not going to do you any good to hit them. They still can't cough. Anyway, so they can't cough. The codeine and hydrocarbon-based cough suppressants are still widely used. If you use Robitussin AC, it has codeine in it. If you use Hydrocodone syrup, it has hydrocodone in it. People will abuse these substances for their psychedelic effects. When my son was working in Hollywood, he was working at the clubs in Hollywood as a bartender. People would, they'd come to the club with their pockets full of cough syrup. And then they'd go out on the dance floor and they'd guzzle this stuff. And it would give them a buzz, give them a really good buzz. Robitussin was the favorite back then. I guess Hypodane has become popular. If you listen to some of the rap stars or some of the rock music, some of the hip hop stuff, they talk about drinking cough syrup at the clubs in Hollywood. So they abuse it. Unfortunately, an overdose of psychedelic substance, dextromethorphan, can cause respiratory suppression, nausea, and vomiting. Of course, it makes them throw up, which is not the prettiest thing in the world, but it's cough syrup, so it smells like cherries. So when they vomit the alcohol that they've been drinking, and they vomit the cough syrup that they've been drinking. And this stuff tastes like cherries, so it's not that bad. It's like, I don't know, cherry vodka, them vomiting cherry vodka or something. Anyway, it's a dextromethorphan. What has happened is their bodies are reacting to the cough syrup. They're getting all this amazing high. There are people that have overdosed on dextromethorphan. We're going to talk about those people in the next chapter, I think. Overdose of cough suppressants is usually in combination with other depressants. such as alcohol, benzodiazepines, and antidepressants. This is like taking all these drugs that make you feel good, so that it just shuts down your whole system. You can't breathe, you can't cough, and you of course die. Opioids are also given to control diarrhea. Opioids work on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opioids addicts can suffer from severe constipation, which is kind of irritating. So what do you do for somebody that has severe constipation? Give them a laxative? Well, if they've got a blockage, it's not going to work. All it's going to do is create pressure, and it's going to blow out their intestines. It sounds horrible, doesn't it? What do you have to do for them? You better get that stuff out of there. You got to get that stuff out of there, because your body is naturally trying to move everything down, trying to get rid of everything. This is a continual flow. Everything is pointing toward getting rid of this stuff. So you have to go in there and get it out. And the first thing you do is go in and try to dig it out. So you go up through the rectum and try to pull it out. And if the blockage is somewhere else, you have to do surgery and cut it out. There was an actor that had a bowel blockage. I'm trying to think what his name was. It's the guy that was in Rob Roy, that Scottish actor. What's his name? He had to have surgery. And it sounds stupid, doesn't it? Well, they just cut my abdomen open so I could take it down. And that's exactly what happened. And guess who's a heroin addict? Exactly. Liam Neeson. Heroin addict. Opioids affect every part of the body, but especially your heart, your lungs, your brain, your eyes, your voice box, your muscles, your cough center, your nausea center, your reproductive system, your excretory system, and your immune system. The probability of getting pregnant while you are a heroin addict isn't very high. It happens, but it's not very high because it lowers the probability that you'll have sex. Physical side effects of opioids, but especially heroin, includes insensitivity to pain, of course. It lowers your blood pressure, it lowers your pulse, it lowers your respiration rate, and it causes confusion. And this is why people like it, because it makes them feel confused. They can't think of anything. It's like their brain is empty. Suddenly it's empty. So all your problems go away. Write that down. All your problems go away on heroin. How perfect is that? Of course, you can't poop, but who cares? And you can't breathe very well, and you can't cough, but who cares? It's the coughing. Well, nobody cares about coughing. At stronger doses, opioids, but especially heroin, might cause droopy eyelids. This is okay, imagine, if you will, that you work in the emergency room, and somebody comes in and you're not exactly sure what's wrong with them, but they're kind of out of it. And somebody's brought them in because they thought that they stopped breathing. So they brought them in because they don't want them to die, which is kind of nice. Anyway, so the first thing that you look at their faces and what's going on. Well, they can't open up their eyes. They have droopy eyelids. They can't control their heads. They can't sit up straight. They slouch. They can't hold their heads up. They have slurred, slowed, raspy speech, if they have any speech at all. If you can get them to say anything, they don't make any sense. They have slowed coordination in walking gait. They can't actually walk on their own. They can move their legs, but it's not like they're walking. They can barely control themselves. They have pinpoint pupils, and all we have to do is look at their pupils and know exactly what's going on. So if somebody comes in and we've got all of these other things going on, especially the droopy eyelids, what we're going to do is we're going to raise up their eyelids and see what their pupils look like. These individuals have no pupils at all. You can barely see them. They are pinpoint. It looks like they don't have any pupils at all. It looks like a drawing somebody made. It's the most bizarre thing in the world. At that point, we're going to give them Naloxone because we figured out what the hell's going on. We know that they've got it's an opium overdose. And if we don't stop it, they're going to stop breathing, and then we're going to have to put them on a ventilator, and we're going to keep them in the hospital for an extended length of time. So what we need to do is we need to shoot them up with naloxone, which blocks opiates. It'll allow them to start breathing again. The other thing that will happen is histamine release causes dried and itchy skin, and these people will dig it themselves. If they can move their arms, they'll dig it themselves. They feel like they have bugs crawling all over their bodies. Suppression of the cough center, hindering the clearance of phlegm, of course, and they will gag to death if you're not careful. You got to keep an eye on them to make sure that they don't choke to death, because they can't clear their throats. Vomiting due to the activation of the nausea center, and this is what killed Jimi Hendrix. He was laying on his back. He vomited, and then he choked to death on the vomit because he couldn't get rid of it. Now, normally, if we get something in our throats, we cough. But Jimi Hendrix couldn't do that. He had just vomited, and he choked to death on his own vomit, which sounds horrible, if you can imagine. But he couldn't cough, and he's dead. Severe constipation is the other thing. Of course, you don't talk to people about them pooping at this point. As soon as we saw the pinpoint pupils, now we've treated them with naloxone, and possibly they'll come back to normal. Delays your menstruation. It really messes up your periods. So what's the probability of this individual getting pregnant? Well, not very high, but it still happens. Reduced testosterone production in males, dulled sexual desire to the point of indifference. So we have crack whores, don't we? These ladies will do anything for their next fix. But we don't have heroin whores. It doesn't work that way. These ladies can't function sexually. They don't want sex. They don't feel like they need sex. They can't remember what sex was. And if it's a male, wow, this is like taking a drug that causes impotence. And it does, it causes impotence. So a heroin, if you think that heroin is sexy, it's the very opposite of sexy. These individuals can't have sex. They can, of course. Well, he can't, but she can. If you've ever seen a movie with a lady that shoots up with heroin and she's a prostitute, she can't be a prostitute while she's shooting up with heroin. I was watching this one movie, and I can't remember what it was, but it just struck me that this lady came to this guy's room. She was a call girl. She came to this guy's room. She said, "Is it okay if I shoot up?" And he says, "Sure, go ahead." He wasn't very experienced with this kind of stuff. She shoots up, lays down on the bed, and she passes out. And she's a prostitute, and she's supposed to be having sex with this guy, but she can't have sex. She doesn't care. She doesn't want to. It's the last thing on her mind, as odd as that sounds. So being a crack whore is possible, because crack, of course, there is a sexual aspect to crack, but as far as opiates are concerned, it's impossible. So a heroin whore does not exist.
Kind of sounds like that movie, Losing Isaiah.
It could be. It could have been that movie.
There's a movie on Drew, what's her name? But Halle Berry?
Halle Berry? So she was a heroin addict, and
yes,
that's why she lost Isaiah?
Yes.
Okay.
And then a Caucasian family adopted him.
Right.
But the lady was a nurse in the hospital, and she fell in love with the baby, and she couldn't give him up, so
right.
she took him in.
So in the movie, they raised him, in the end, they raised him together or something like that?
Yeah.
Yeah, she helped her get off of heroin. Yeah. So a heroin whore, it doesn't happen. I know that sounds gross, and I wish I didn't have to talk about it, but I mean, this is reality, all right? Jimi Hendrix is dead because he vomited and couldn't cough it out. I apologize. It's not my fault. I didn't do it. I didn't shoot him up with heroin. It was his girlfriend who shot him up with heroin. Tolerance for opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in your liver. It desensitizes the nerve cells that the substance affects. It increases drug excretion by increasing urine, feces, and sweat output. alteration of the brain chemistry to compensate for the effects of the drugs. So one of the things that happens to you when you're going through withdrawals is that you get diarrhea. Remember, it constipates you, it slows down your intestinal tract when you're on opiates. So the opposite is, this is when you're going through withdrawals, all of a sudden you have diarrhea, you can't control it. The other thing is that you sweat like crazy, and it stinks. It really smells bad. And the reason it smells bad is because if you've ever smelled somebody that was afraid, they have a specific odor. They put off this specific odor. And these people are scared to death. They're scared because they're going through withdrawals, and it hurts, and it smells bad. It's like they are scared to death. And in essence, they are scared to death. Really the oddest thing in the world. So you know if somebody's coming off of heroin. It's interesting because I've been walking down the street and not really thinking about anything, and I'll get this whiff of somebody that has that is coming off of heroin, or they're going through withdrawals. And I'll just pass them on the street. Whoa! And of course I've smelled it before, so I know exactly what it smells like. And that I know that person is a heroin addict. And I know that person hasn't had a fix in a while because they're going through withdrawals and they're starting to sweat. It doesn't matter if it's a male or a female. Males and females smell very similar when they're afraid, even though female sweat is not the same as male sweat. But you can smell it. You think I'm kidding? I'm not. And I know what it smells like, as sad as that is. Opioid tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. And of course, so the tolerance is very rapid because remember, the human body is trying to protect itself. And the only way that it can protect itself is by making everything balanced. So the human body is trying to get rid of as much of this toxin as it possibly can. And that's why it speeds up the metabolism in the liver. The liver's trying to get rid of all these toxins. And so it's building up a higher tolerance. So this individual may have to increase their usage by as much as 10 times in 10 days. Chronic use of opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opioids will reduce the dopamine-producing cells in the tegmental area by 1/4. Now, dopamine-producing cells are the cells that dopamine makes you feel good, makes you feel happy. So if we have 1/4 fewer of the dopamine-producing cells, now we got a really serious problem. This person can't be happy. But it's trying to protect itself. The brain is trying to protect itself. You are overstimulating it, so what it's doing, it's killing off the cells that would make you feel good. It's trying to protect itself. Hence, these individuals have less of an ability to feel pleasure or even normal. Another reason to take the drug, of course, is because they're trying to achieve normality, a feeling of normality. At this point, the body relies on the drug to feel normal, and this is really kind of tragic, if you think about it. Now, if we reduce our dopamine, what happens next? If we have dopamine-producing cells and we lose those cells, what happens to us? That's Parkinson's disease. Doesn't that sound like fun? Let's all go shoot up with heroin and we'll get Parkinson's disease when we're in our 50s or 60s. Doesn't that sound like a good time? For a good time, use heroin. You can't feel normal anymore without the drug because you have just lost all of these dopamine-producing cells. This is a tragedy, and it's stupid. Withdrawal from opioids may take place in 3 stages. The acute withdrawal phase, the body tries to return to normal too quickly, of course. The post-acute withdrawal phase, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after the use of the drug. We see a lot of actors, we see a lot of rock stars that are trying to get off of heroin. So they go to the Betty Ford Institute, or they go someplace, they go to a retreat. And how long do they stay there? Well, it took Robin Williams 18 months. Sometimes they have to be there for a year and a half to start feeling normal again. And he was on cocaine and crack, I think, if I'm not mistaken. Of course, 3 to 18 months after the drug use, this is the post-acute withdrawal phase. The protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. The problem is you have a decrease in your blood pressure, decrease in body temperature, decrease in respiration, feeling of general uneasiness. I'm thinking of some of the people that I've seen. A lot of these individuals will wear down jackets in the summertime. Why? Because they can't control their own temperature. So if the temperature is below 98.6, they're cold. So they have to wear a sweater, or they have to wear a down coat, or they have to wear a down vest, just in order to feel normal. There you go. I must not be on heroin. I'm able to clear my throat. This reaction might be triggered by environmental cues that incite the memories of their addictive life. These cues can persist for decades after cessation of use. And a lot of these individuals, in order for them to become normal again, what they have to do is stay away from the people that they were around when they were using. They have to stay away from them. And we see this a lot with actors. We see this a lot with rock stars. Short-acting opiates, opioids, 2 to 3 hours result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. Short-acting opiates, opioids are heroin, morphine, hydromorphine, also known as Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. So the short-acting opiates, it only takes about 7 days to get off of it, to withdraw from it. But these people are spending a year and a half in rehab. Why in the world is that? Why is that happening? Well, I explained it to you on the last slide. Long-acting opiates such as methadone and levo-alpha acetylmethadol take 1.5 to 3 days to get off of it. The peak withdrawal is about the 4th to the 6th day, and recovery may take as long as 2 weeks. But that's very few people. We don't really have to do this very often. We use methadone as a treatment for heroin. Opiates, opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long term. Codeine, oxycodone, or Darvon, if that is what they're trying to get off of, it's somewhere between 1 and 2 weeks for the severe withdrawal symptoms. When I think of the severe withdrawal symptoms, I usually think of the smell of the sweat of these individuals. And you can tell when they are recovering because the smell goes away. They stop sweating as much as they did before. Geez, I don't even want to tell you what it smells like. Sure I do. Okay, I'm going to tell you what it smells like, but I have to talk about poop. Are you ready? Can you handle this? Are you sure?
I think hearing is better than actually.
What?
I think hearing about it is actually better
than smelling it yourself? Yes. Okay. This is just a hint and a warning in case you ever come in contact with any of this stuff. Okay? It smells like if somebody's had diarrhea for a long time, for an extended length of time, if you have any idea what that smells like, that's what their sweat smells like. It smells like diarrhea. Okay? But it smells like they've already cleaned their bowels out, okay? And it just smells like the liquid that comes out. It's a real strong odor. As odd as that sounds, I apologize. So this is going to be interesting, because if you ever come in contact with one of these individuals and you think, oh, geez, they must have had an accident. Potentially they didn't have an accident at all. It's just their sweat. And once you smell it, you'll never forget it. It's an acrid. It's hard to explain. Anyway, it smells like diarrhea. That's what it smells like. That's what it smells like to me anyway. One of the curious withdrawal symptoms of opiates, opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by the opioids. Remember, well, I was talking about the lady that was a prostitute, and she shoots up with heroin, and she immediately goes to sleep, and the guy doesn't have the good time that he thought he was going to have. So one of the things it does, it slows you down, it stops you, it makes you feel euphoric. But the euphoria doesn't have anything to do with activity. So if you go through the withdrawals, these individuals are moving all the time. They're nervous. It's erratic movement. And that mostly is because of the norepinephrine. All in all, people rarely die from opioid withdrawals as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. It looks very similar to the flu. They can't stop coughing. Their nose keeps running. It's kind of like cocaine. They're coming off of cocaine. Their nose is running constantly. They've got stuff coming out of them. They're constantly urinating. They have bowel. They can't control their bowels. Well, they can. I mean, they have diarrhea. So all of this stuff is taking place. You don't die from that unless you try to go cold turkey and you forget to drink, because you need to drink. You've got all this stuff coming out of you, and if you don't, you'll become dehydrated, and then potentially it can kill you. But people very rarely die from opioid withdrawals. So why is it so difficult to stay off of heroin? Why do these people keep going back? Why do they keep using? They go through rehab for 3 or 4 months, they come out of rehab, they're clean, and all of a sudden they start using again. Why? Why? It's worse than any other drug. It's not the fact that the withdrawals are going to kill you, it's the fact that you can't stay away from the stuff. Why? What is it about opiates, about heroin, that makes you have to use it? Why does this happen? We can stop drinking alcohol, we can stop snorting cocaine. Once we stop, a lot of times we can stay away from it forever. Heroin, it's rare. It's extremely rare for people not to relapse. Why is that? Why? It's because of the feeling that it gives you. You want that feeling of emptiness, of nothingness, of death. It makes you feel like you're dead when you shoot up. You can't think of anything. And that's what they want. They want that empty-minded feeling. And they can't stay away from it. And also, if they've used too much, the toxic level has actually destroyed their ability to feel good. And if you shoot up, you don't feel anything. And that's the feeling that they're looking for, this feeling of nothingness. The problem of opioid withdrawal is the fear of the withdrawal, since this is the area of the brain that is mostly affected by the drugs. So that's the reason it's so hard to come off of heroin. Alcohol, of course, we can send people to rehab, and we can detox them, and usually it's not nearly as bad as the withdrawal symptoms are. You can die from the withdrawal symptoms of alcohol, but you very rarely will you see somebody die from withdrawals from heroin. Normally what you see is an individual who has just gone through rehab, and then when they go back, when they relapse, when they shoot up again, they overdose. And then it kills them. Neonatal effects of opioids usage are extreme because the drugs readily cross the placental barrier. Pregnant opioid users are at a greater risk of miscarriage, placental separation, premature labor, breech birth, stillbirth, eclampsia. Does anybody know what eclampsia is? Did they talk about that when you guys had a baby? You got kids. Did they talk about eclampsia?
I think I've heard of it, but I forgot.
It has to do with high blood pressure.
Is that when you swell up or something?
Yeah, it causes you to swell up. You can't clear the fluid out of your system, and that's eclampsia. But that's a sign of eclampsia. The fact that you're retaining water, and that's a sign of eclampsia. It's high blood pressure. If the fetus survives these dangers, it will be just as addicted as at birth as the mother is. And of course, I told you that I have a great niece that had a baby that was addicted to heroin because she went to the she went to the health department. She said, "I'm a heroin addict and I'm pregnant." And they said, "Okay, we're going to give you a substance that will not make the baby addicted, but it feels just like heroin." And so she took that stuff. And at the same time, she shot up with the same amount of heroin that she was using before. So she was addicted. The baby was addicted when the baby was born. It took him 6 weeks. He was in crisis for 6 weeks because of her heroin addiction. She put pictures on her Facebook page of her smoking cigarettes while she was pregnant. Yeah. I could have punched her right in the face. Idiot. When the baby was born, they took the baby away from her, of course. She's a heroin addict. She's obviously a heroin addict. She can't take care of the baby. She can't even take care of herself. So she couldn't take care of the baby. The baby is 3 years old now, and he's normal. He's relatively normal.
Same age as my daughter.
There you go. We won't introduce the heroin. I don't trust the kid. Oh, he was an addict when he was born. What's the probability he's going to grow up normal? He became sensitive to things that make you addicted. Everything in his life, he's going to have to use in moderation. Everything. Caffeine, tobacco, because he has that circuit. That circuit was created in his brain where he is seeking to complete that reward reinforcement loop in his brain. And he's going to be addicted to anything and everything. So they have to be really careful about this kid. With cereal, with everything, because he is susceptible to addiction for the rest of his life. And the other problem was that this kid cried all the time. It was terrible. Irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. He had it all. He was a mess. He still is a mess. He has ADHD. And he's only 3. And he's already been diagnosed with ADHD. But they can't give him any medication to help his ADHD. Because if they do, he's going to become addicted to it. If the neonate survives withdrawals, the effects will last for 5 to 8 weeks. And of course, he was out for 6 weeks. 4,000, 5,000 people die from opioid overdoses every year. Actually, that's close to every month now. The opioid crisis in the United States is more severe than we've ever seen it before. And the worst place, do you know what the worst place is in the United States? Is it New York City? Is it Chicago? Is it Los Angeles? Is it Denver? It's West Virginia. West Virginia.
I would have been dead wrong. I was going to say New York or Chicago.
Yeah, of course. We would all say exactly the same thing. It must be the cool people. Yeah, it's the cool people of West Virginia. They're about as cool as, well, I can't even think of anything that's that cool. So why are they addicted to opioids? Painkillers. They've all got back problems. What a surprise. I've got severe headaches. All of these, and it's the most severe problem. They have more overdose deaths than any other state. And number 2, guess what number 2 state is? If number 1's West Virginia, guess what number 2 is? New Hampshire. Really? New Hampshire? Come on, let's get real. 1.5 million drug-related emergency room visits occur per year related to opioid overdoses. Now the police, the first responders, are carrying around Naloxone in case they come across somebody that has an overdose, an opioid overdose. In one study, only 57% of the opioids were accidental, of course. Of course they weren't, because you're shooting up and you're trying to get a better high. Remember, you have to take the same amount you took yesterday just to feel normal. So if you want a high, you're going to have to take more. That means tomorrow you're going to have to take more. That means the next day you're going to have to take more than that. How much money do you have? How wealthy are you anyway? Isn't that crazy? So what's the probability that you get a select amount of heroin and you use more than you should have? And all of a sudden, not only can you not cough, but you're not breathing, and your blood pressure is just tanked. And now you're dead. What opioid overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. The respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins in their system. This is not a pretty death. It doesn't look good. It's like drowning, okay? Your lungs fill up with fluid. It is an ugly, ugly death. It's very, very painful to watch. And of course, I'm pissed off because I've got to try to bring you back to life. And you just shot up with heroin. You didn't know how much was in there. You never know. Is it pure? No, it's never pure. But how much was it cut with? Is it 25%? Is it 35%? Is it 50%? It's usually 50%. But sometimes it's 25%. And you never know. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. HIV, of course, and hepatitis C are relatively common in the IV drug culture. I won't give you any of them. Oh, you will. A look at individuals who have only shot up for a year shows a rate of 71.4%. This is hepatitis C. Now we have a cure for hepatitis C. I know, I'm all excited. But at one point, there was no cure for hepatitis C. It was chronic, and you would keep it for the rest of your life. 20 to 40% of those infected will develop liver disease. 4 to 16% will develop liver cancer. And this is really the serious problem with hepatitis C. It isn't the fact that hepatitis C will kill you. It doesn't. But you're more susceptible to liver disease and to liver cancers, as horrible as that sounds. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. So it's less likely that a woman will use heroin. But you're not safe. Because guess what? If you've got a boyfriend, you've got a spouse, they have a higher probability of using heroin or crystal meth or whatever to be an IV drug user. It's usually the males that are the IV drug users, and you're the person that they have sex with. And because of that, if they get contaminated with hepatitis C or HIV, now they're going to contaminate you. 7 to 10% of the HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of the children with HIV had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. Ouch. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins, being used for injection so that the individual has to go to more and more difficult sites for their fix. They'll go to the wrist, they'll go between their toes, they'll go to their neck, they'll either go to the dorsal vein in their penis. If they are male, of course, there's a blood vessel right beside the eye that they'll go into. As much fun as that is, I'm not going to tell you that story again. The speed freak. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. It's getting rid of the withdrawals. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. These individuals will die of Staph aureus, or maybe beta strep group A. These are very extremely virulent bacteria. And if they get into your throat, you've got strep throat. If they get into your veins, you've got an abscess. and sometimes they are tissue-eating bacteria, and they'll just eat a chunk out of it. As pretty as that is. Are you ready? Are you ready to see a man that had a chunk eaten out of him? There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where a virulent bacteria gets under the skin and eats tissue away, and that's what happened to him. Endocarditis, bacterial infection of the heart valves. Cotton fever, short-term bacterial infection. So that a lot of times they lose chunks of meat. That guy has lost part of his side. This guy's from Scotland. A lot of heroin users in Scotland. And unfortunately, of course, he contracted a bacteria that was a tissue eating bacteria. Necrotizing bacteria. Necrotizing, what does that mean?
Tissue death?
It means death, exactly. So what it does, it kills the tissue. The bacteria can't eat healthy tissue. The bacteria can only eat dead tissue. So the bacteria will get in there and it will kill the tissue. Then it has something to eat. Doesn't that sound exciting? I know. Well, at least it gets, it's hungry, so at least it gets something to eat. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age for first alcohol use is about 16.4. The mean age of first tobacco use averages at 17.3. The mean age for first marijuana usage is 17.4. The mean age of first heroin usage is 22.2. So adults use heroin, right? Because that's the average age of first usage. Marijuana is 17.4, well anyway, as you can see. From first usage to daily habit averages about 1 year of sporadic usage. So this is a drug for people that have graduated from college. It's a drug for people that are 23 or 24 years old. Because it takes about a year to become an addict. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4. This research was done in Scotland. Remember, Scotland has had a really serious drug problem for an extended length of time. If you want to see the heroin addiction from Scotland, watch the movie Trainspotting. Have you ever seen the movie Trainspotting? There's a Trainspotting 2 out now. I guess most of the guys that were in Trainspotting 1 died of overdose. Anyway, okay, so they followed these guys for 33 years. The average starting age was 23.4. They found that after 33 years, more than half of these individuals were dead. 582 heroin users. Half of them were dead. That was at the age of what, 56? They were dead. 50 to 100 times greater the general population, of course. They died of overdose, they died of accidental poisoning, they died of homicide because they're in that lifestyle. They died of suicide, they died by accident, they died of liver disease. 44% still used heroin. After 33 years, they still used heroin. I know. 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. There's a shock for you. The group now averages about 57.4 years reported frequent interactions with the criminal justice system at 57.4 years. Wow. Morphine is, okay, now we're going to talk about the different drugs. Morphine is metabolized by your liver. It's 3 to 6 times the morphine. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. So you have to, if you're taking a pill, you have to take 3 to 6 times as much as you would if you were injecting it. Morphine will be detectable in the urine for several days after ingestion, and so you get a positive opiate. One out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, or severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain. Oh, that's right, you've got class, don't you? I forgot, okay. Chronic pain. Now, this is ugly stuff, I apologize. I'm glad Marius is here. I was really feeling bad about all this stuff. In one research of chronic pain sufferers, 72% had suffered for more than 3 years, and 34% suffered more than 10 years. We're talking about morphine usage here. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because fear of tissue dependence and addiction, fear that the painkiller would mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems. I know this is really good news. Drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible, of course. So if you have an addictive personality, like my great-great-nephew, he has a greater probability of a problem. Codeine is used for cough suppression. I had my tonsils taken out when I was 20 years old, and they gave me codeine for the pain, and it didn't work. So I chewed aspirin, that worked, but the codeine didn't work. I know, the opiate didn't work. It's the first time I ever used an opiate, and of course it didn't work. So the next time I used an opiate, it didn't work either. There's a shock for you. So after that, I kept telling the doctors, opiates don't work on me. And guess what the doctors gave me? Opiates, of course, because that's all they know. They're stupid. They are so stupid.
I don't think opiates work on me either.
Then tell the doctor, and he won't give it to you. Maybe. And does Tylenol work? Will it take the pain away?
Yeah.
Okay, it works for me too. My problem was, I believed maybe this time the Hydrocodone will work. It didn't work. I needed the Tylenol. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is known as it's a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its #1 ranking, of course, was taken over by Hydrocodone. So we used to use codeine all the time. It's in Robitussin AC, but not anymore. Well, it still is in Robitussin AC. Pimp C and DJ Screw died from cough syrup overdoses. These are 2 rappers.
What the heck? Cough syrup? Really?
They drank.
Popular in my town.
Oh, was that right?
Yeah,
Cough syrup?
Back in my high school years.
Is that right?
People would go out and buy the Robitussin.
Robitussin AC?
And they would drink it, the whole thing, and I tell you, they were
Buzzed out of their brains. That's so cool. And here's 2 guys that died from drinking this stuff. As I told you, my son worked at a club in Hollywood, and this was very popular. Of course, he was there in the late 90s, early 2000s. Anyway, this is really popular stuff. Hydrocodone, also known as Vicodin, Hypocodone, Tussin, or Norco. It's a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. Really serious problem. We've got a lot of people that are drug seekers. And for that reason, there are a lot of doctors that will not prescribe opiates for pain. They won't use opiates for pain. Abuse of this drug is usually precipitated after the drug has been prescribed legally. Come on in, that's okay, that's all right. Sit beside Marius. Or sit as far away from him as you can get. Sit over in the corner. Heavy abuse has been known to cause hearing loss. Really? Hearing loss? 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. Of course, this figure has gone up. It goes up every year. Hydrocodone is one of the more serious.
I think I've seen a lot of hydrocodone.
Right. Yeah. Vicodin. People are using Vicodin. Methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium. So they needed opiates. They needed opioids. They needed synthetic opioids. And so the Germans are the ones who came up with all this stuff. If it wasn't for that, we just have heroin and Demerol. No, not Demerol. What's the other one? What's the other one I'm trying to think of? I can't. It's not. Anyway, that we would only have opiates, not opioids. Methadone is less powerful than morphine, and it lasts longer in the individual system. It is authorized in the United States as a treatment for heroin addiction. So if you go to a clinic and you've got a heroin addiction, potentially in the United States, they will put you on methadone. And methadone, of course, they'll give you a lot more of it than they would the heroin if you were taking the heroin, and you can get off of the heroin with the methadone. It's a lot easier to wean people off of methadone than it is to wean them off of heroin. But like I said, you normally do not die from the withdrawals from heroin. The reason you relapse is because it feels so good to use it. The withdrawals hurt too much. So people will relapse. They'll start using again. They don't want to think about anything. And that's the biggest problem, of course. And this is what we were talking about before. The problem is heroin makes you forget everything. It empties your brain. And that's what they want. It makes you feel like you're dead. The first guy I ever talked to that was a heroin addict, he said, it makes you feel dead. I said, really? Why in the world would you take this? Because it makes you feel so good. Dead is good. No, in this case, of course, it empties your brain. That's what it does. So when you need to forget, what do you need to do? Start using again. Come on in. You're okay. Don't worry about it. But you have to sit beside Marius. No, I'm just kidding.
You're gonna be sick in the first place. I still have to try it.
It's his fault. There are 1,292 methadone treatment programs in the United States. There are, of course, 228,000 heroin addicts in the United States at the time of Dilaudid hydromorphone. It's refined from morphine. Gram for gram is 7 to 10 times more potent than morphine. So if you were to use Dilaudid, of course, it is that much stronger than morphine is. Because of its potency, hydromorphone is stringently controlled. This stuff we rarely see outside the hospital. Are you ready for fentanyl? I'm not. Wait a minute, where is fentanyl? Where is fentanyl? Fentanyl is 100 times stronger than morphine.
I think you passed
Did
it.
I miss it? Hydrocodone? Okay, fentanyl is 100 times stronger than morphine. So for the longest time, the only way you could get fentanyl was in the hospital. Then what did we find out? Prince is dead from a fentanyl overdose. Where the hell did he get fentanyl? Tom Petty dies of a fentanyl overdose. Really? Michael Jackson dies of a fentanyl overdose. This is not a street drug. This stuff is too powerful. But it's on this. Well, these 3 rock stars had fentanyl. Tom Petty had 3 different types of fentanyl in his system when he died. Where is it coming from? It's 100 times stronger than morphine. Who wants to shoot up with it? You can't. How much are you going to put in your system? A microdrop? This is nuts. Only a doctor can prescribe this stuff. And here these 3 rock stars have died from fentanyl overdoses. This is nuts. It doesn't make any sense. This is dangerous stuff. Why don't we stop right here and we'll pick this up next time. I'll stop preaching against fentanyl, my favorite drug, of course.